and that's this one here. Palmaris longus. Most of us have one, and if you try to find the nerve and you're not quite sure where to even look for it, keep in mind that palmaris longus is the structure that's very shallow, right under the skin. You can see it on your own volar wrist. The nerve is deep to that, and deep to that are the flexor tendons. Another thing you can do is you can ask the person to move their fingers, wiggle the fingers a little bit. The tendons will move, the nerve will move just a little bit passively back and forth, but not a whole lot. So if you're not quite sure which structure is my nerve, that's one way of sorting this out. You look for movement of the flexor tendons, and you look for just a little bit of passive movement here of the nerve on top. Not really a lot of movement. You can also look at the patterns. So nerves have this, some people call this tram track pattern. They are less echoic than the tendons, so the nerve looks a little bit darker. In short axis, you get this salt and pepper structure, and in the long axis, you have these longitudinal lines. However, we have to think about artifacts. So those tendon fibers are curving, they're sloping downward, so they look darker here and they look brighter here. We all know now, in the meantime, what that is. That's anisotropy. So the sound waves are coming down from the transducer. These ones here are bouncing them back, straight back to the transducer, so we get a strong signal here. The sound waves come down and meet these tendons, and they're being reflected at an angle, so you get less sound energy back from the same structures to the transducer. So that's why this looks artificially dark or anechoic. You can change that by adjusting your transducer and pointing the transducer more towards these tendons, and then it will become bright as well.